Hello, my name is Norma, and I'm a breast cancer patient. The first visit, they take your blood work, and the nurse will take your vitals and basically explain to you what you're going to be going through today. Then I meet with my medical oncologist. The medical oncologist explains the treatment and how to manage the side effects and prescribes all kind of medications to you to help you manage your side effects. And that's the 4 hours that take place there, but altogether from the appointments I had before and the chemotherapy, my first session was almost 8 hours.
Chemotherapy basically is a term we use for any type of drug given to fight cancer. It's a bit of a confusing term now. We have many new treatments for cancer that are not chemotherapy, such as biological agents, antibodies, new pills, but the majority of patients getting treatment in a community cancer clinic will be getting traditional intravenous chemotherapy, and the drugs that are really targeted to attack the DNA of cancer cells.
The whole experience, especially now, has really limited my ability to be as active as I like to be, because I have to be very careful. My immune system is, I would say, not shot, but has been weakened, because every time you go through chemo, it's biting at your cells. My doctors prescribe you painkillers because my bones hurt, my muscles hurt, I'm sore all over. So they give you something to help manage the pain. I have a burning mouth, and that lasts. I mean, it hasn't left me since I've started chemotherapy. So I've had burning mouth, I have to admit, since August.
So stomatitis is a side effect of both radiation to the mouth area or many cancer drugs. And it's not only chemotherapy drugs. The most typical drug to cause that will be 5-fluorouracil. But other drugs, taxanes that come from the yew tree, any chemo drug can sometimes cause that side effect. And it can be very difficult for patients. It can make it hard for them to speak, to eat, to keep down their hydration and drink enough fluids to maintain their health. So, we're very careful to monitor that. Traditionally, there have not been very effective ways to prevent it. We've given people mouth rinses that contain a combination of, a bit of Kool-Aid, flavoring, baking soda, antifungal medications to prevent yeast infections settling in, and basically some freezing to help numb the mouth. And many places call that chemo mouthwash or magic mouthwash. So oral mucositis, it really varies. Some people can have grade 1, where they might have a little bit of soreness, a little bit of sensitivity, 1 or 2 small canker sores, and they generally heal in days or a week. But if people have higher grade stomatitis, it can be really a problem. And remember, if they get it with chemotherapy, they usually will get it after every chemotherapy.
What I normally do is I'll swish my mouth with baking soda and water, and I'll do that 4 to 8 times a day. And then I'll use nystatin, which is used for thrush, and I'll use that afterwards. And again, that'll be between, they say 4 times a day. I do it more often. And it's really to relieve the pain, the burning, but it takes it away temporarily. And very quickly, it comes right back.
The side effects really of chemotherapy, traditional chemotherapy, the ones patients worry about are hair loss and vomiting. And vomiting tends to be the most feared by patients. The main advance that I've seen in my 22 years now has been advancements in supportive care, as well as advancements in cancer treatment. So example, again, some chemo used to cause so much vomiting, people were admitted. One of the biggest single advances in 20 years has been the development of very effective antiemetics, medicines we give prior to chemo to prevent vomiting. The granddaddy of those was one called ondansetron, and that probably has been the biggest revolution in our ability to give cancer treatment safely. Those supportive care medications have really made the journey for the patients much more tolerable.
And I have tremendous compassion for any patient that goes through this. I don't wish it on anybody. It is what it is. I mean, I'm blessed in every way. I've had tremendous support from my family, my friends. And 9 years ago when I went through this, it gave me a tremendous and a completely different perspective on life, because life is short and you have to live every day to the fullest.
Lights will guide you home, and fix you.